You might want to check in the American College for the Advancement of Medicine website and see what doctors in Canada are doing this kind of work. I was a very good friend of Hugh Reardon. I don't know if you know the name. And Hugh Reardon did much of the high-dose intravenous vitamin C work. We're friends for many years, and I spoke at his conferences, and he visited my office and stayed with me for a week and saw what I was doing. And he decided to start combining lipoic acid with vitamin C. And he said he was getting some very good results. You give vitamin C intravenously in the morning and lipoic acid in the afternoon after somebody had something to eat. And the vitamin C that was still in the bloodstream, after it was used up, was recycled by the lipoic acid. So he got like twice the bang for his buck. And I do that sometimes too. Lyme disease. We have Amish people and Mennonite people from Pennsylvania coming out all the time to be treated for Lyme disease. And folks from out east, we have probably 100 people with Lyme disease. And I'm a microbiologist originally. My PhD's in an area of microbiology. And I look at diseases caused by microorganisms probably very different. I look at it like a PhD rather than an MD, necessarily. I'm a big believer in antibiotics during the acute phase. But I think every organism that we ever get sick from, even after treatment, is still in our bodies. And as long as you take good care of yourself and you do certain things, these things don't manifest themselves, and you're fine. For years, I volunteered at Rutgers University to teach the field courses. So I was always out teaching field zoology and field botany in the woods of New Jersey and Pennsylvania and New York. And I was bit by deer ticks all of the time. And for a while, I'd have joint pain, and I'd forget about it and take good care of myself and do certain things. From time to time, I take erythromycin or doxycycline, and it seems to control it. But we sort of have a program for Lyme disease, and most people do very well. I don't believe in intravenous antibiotics until it almost kills you. I think there's a way of using antibiotics. I think the perfect example of this is a viral disease, and it also it can be used as a model for certain bacterial diseases. When we're kids, we all get chicken pox. Sometimes we don't know it. We just get a few vesicles, but we get chicken pox. And we get sick, and our immune system beats up that virus, the chicken pox virus, sends it to a ganglion along your spine, and keeps it dormant. But as an adult, if we all have the chickenpox virus in our bodies now. As an adult, if you're under a lot of stress, physical or mental, emotional, for long periods of time, the virus becomes active and causes shingles. But when the stress goes away, your immune system beats the virus up again, sends it to its room, locks the door, and we don't have shingles anymore. But if you have post-herpetic syndrome, post-herpetic zoster syndrome, you continue to have the pain because of the stress. But once you break that stress, it often goes away. Same thing with Lyme disease, which is caused probably by several different parasitic organisms, protozoans and bacteria. It becomes active when you're under stress, and usually when you're calm and happy, you don't have the problem. In European lipoic acid?
That's something I'm going to find out now because of what you're saying.
Very important because, you know, most of the lipoic acids that I see have the cheapest junk in them. A few have wonderful products. And if you take a tablet, I don't like tablets either. I like capsules. Because if you take a tablet of lipoic acid, they put it under heat and pressure, and they probably destroy and change a lot of it. If you're getting too much, you have to take an awful lot to get too much. Like we never go above 15 milligrams per kilogram, 15, 1-5. And it takes about 90 to kill somebody. So that's a tremendous amount of lipoic acid. But the amount I prescribe for you is enough. Lipoic acid is the king of all, the captain of all antioxidants in the body. It does so many things, and it's such a small molecule, and it's so active. It's just a magnificent natural molecule that we produce. I wrote a book with some co-authors several years back called Syndrome X. I don't know if you're familiar with this. And the basis of this is that, you know, we're very similar physiologically and anatomically to our ancestors from hundreds of thousands of years ago. So we're basically Paleolithic animals. And our bodies were designed to eat vegetables first, meat second, carbs and fats third. And most Americans, like flying in yesterday, you know, everything in the airport, almost everything in the airport was carbs, salt, fats, meats that have been altered, and hardly anything in the way of green vegetables other than lettuce, which has practically, I mean, it's like drinking water. So with our patients, I always suggest, especially if you're sick, 4 servings of green vegetables a day. It's the most important thing. I also suggest staying away from fake foods like margarine or any kind of fake sugar. You know, stick with, if you want a little sugar, it's fine to have some raw sugar in small amounts. Butter is a good product. Many fake butters contain acrylamides and aflatoxins, which are potent cancer-causing agents. If you go to the National Library of Medicine website and you type in aflatoxin, which is a fungal product a fungal toxin that grows on grains in storage that certain margarines are made from. See hundreds of publications that show that some fake butters, or maybe a lot of fake butters, turn on cancer genes. They trigger the growth of cancer. But if you type in the fat and butter butyrates in cancer, see hundreds of publications that show that butter turns off or helps turn off cancer genes. But you don't hear many people talking about that.